covering the stories that impact your life, your town, your state, and your future. This is the Means Report with your host, Brad Means.
Hello, everybody, and welcome once again to the Means Report. We appreciate you spending part of your day with us, where today we're going to focus on the overall health of our community and an incredible operation that's been underway for 20 years and counting now that makes sure a special segment of our community stays as healthy as they can while they're here. Also, we're going to talk about the happenings at Augusta University, and you may say to yourself, Brad, Dr. Russell Keene was just on the Means Report a few short weeks ago. It's true. And when Dr. Keene was on, we determined that we had not come close to covering everything that was happening on and off campus. And so Dr. Keene has been gracious to come back and talk to us in both of our segments today. And as always, we'll wrap up the Means Report with ways that you can stay in touch and help us get more great guests like these first two. Debbie Lehman, we'll start with you, an alum of the Augusta University College of Nursing. Welcome to the Means Report. Thank you for all you do, whether it's through the AU Foundation or just the health fair that we're going to talk about. Thanks for what you do for Augusta University.
Thank you so much for having us today.
Absolutely. And Dr. Keene, welcome back to you. Thanks for coming. We have so much to talk about, and I appreciate your time.
Yes, thank you for having us.
Let's look at this health fair, the Costa Lehman Health Fair that's coming up in a few short days, really. It's not on an Augusta University campus. It seems like it's a great way to reach out and kind of expand what y'all do beyond AU and affect the entire community. Is that accurate?
Absolutely.
Yeah.
You know, for 20 years, and Debbie can speak more to this as far as the background to how this all got started, but for 20 years we've been providing healthcare services to farm workers in this area, and it's been tremendous. What we talk about a lot, as we've discussed, is Augusta University has a statewide mission, but our mission first starts at home. And so we're preparing our students to be active participants and engaged in their communities. And Debbie is one of our alums and is a fine example of that.
Well, I'm glad that you brought that up, because I did want to ask you the origin story of the Costa Lehman Health Fair. You and your husband made this happen. What started it? Was it a conversation? Was it something you noticed in your life that you said there's a need?
Well, about 20 years ago, one of the professors at the College of Nursing, Dr. Joellen McDonough, came to me and said, I have a class for students and it's called Spanish for Medical Caregivers. Could we come to the farm and do some sort of health teaching, screenings, whatever, for the employees so our students could practice their medical Spanish?
And this was back when y'all were in the nursery business.
Yes, back in the nursery business 20 years. This was about 20 years ago. And Barry and I talked it over, and of course, yes, it sounds like a great idea, win-win for everybody. So we had our very first health fair. It was very small. It took us all day long because we'd never done it before. We didn't really know what to expect, but out of that grew the model of what today has become basically a mobile hospital unit set up on a loading dock, and everybody gets an executive wellness visit for their screenings.
Dr. Keene, how heavily is AU involved when it comes to making sure that, I don't know, doctors, nurses, med students, is there at the health fair? Do y'all send a lot of y'all's people over?
Oh, absolutely. You know, as Debbie stated, it started with the College of Nursing, but when we talk about a patient-centered care, the continuum of care, trying to address the patient as a whole human being, their physical well-being, their mental well-being, not just treating disease and illness now, but also prevention and health literacy. And so what this Costa Lehman Health Fair has essentially done is it's got the College of Nursing, the Medical College of Georgia, the Georgia Cancer Center, the Ryan White Clinic, it's interpreter services, our centers for undergraduate research, our literacy, all of this together, and it really is a place where we can treat these patients with dignity, but where they're not all these different isolated, fragmented portions of their health care. And so it involves a host of students, faculty, staff, and volunteers from Augusta University and beyond that really look at this as an engagement opportunity for the farm workers and our students, but our students also get so much out of it as well.
Oh, I bet.
And the benefit has been that not only can they hone in on their skills to practice their healthcare, but they really get an opportunity to collaborate and communicate with other healthcare providers in this type of setting.
Debbie, y'all have seen, well, you see hundreds of farm workers every time you do this fair, thousands upon thousands of them over the years. Can you treat any ailment they have, or is it more of, as you mentioned in your last answer, an assessment, and then after that, the patient, if you will, goes for further care if needed in a hospital or clinic type setting? Is that how it works?
Well, this is set up to be a screening event.
Yeah.
So we screen for basically everything that an executive wellness visit would, plus more than that. So lab work, dental screenings. Dental always gets our highest number of referrals, of all the screenings. Skin screenings for cancers, funguses, rashes, whatever. Body movement, protection. People, it's a farm, so you're bending, lifting, pulling, pushing all the time. So body mechanics are very, very important, for your long-term health and your ability to perform your job. Do hearing tests, vision tests, HIV testing, and then there's a whole complement of community partners that come in for teaching. We have the library there with health resources. Allied Health has a nutrition department, so they discuss healthy eating habits and questions about food and dietary intake. The American Heart Association comes and does hands-free CPR teaching. So it is extremely comprehensive what we do, but it is meant to be a screening event, and then the employees are to be empowered with their health information, so then they can go seek further care.
Are these
necessary?
Excuse me for interrupting. Are these farm workers folks who are in our community and our country part-time and then they go back home? Is that mostly the demographic we're talking about, or are these folks who just live here 24/7?
It's a very mixed demographic of both.
Because my question was, do you have any connections or communication with, if they're not from the United States, their physicians back home to say, look, here's what we found. Y'all need to follow up with these folks.
That's a really interesting question, and it's never come up before.
Yeah.
But we do send everybody home with a screening sheet that has all of their information on it. So they have everything that they need to take back with them to the provider of their choice, wherever that provider may be. But Dr. Cromer, the College of Nursing faculty, who's in charge of this, is very good about helping with referrals, and she, of course, would help anybody as needed to follow up.
Dr. Keene, let me ask you about the interest of your medical students in serving in these underserved areas. I know there's always been a big push to get doctors and nurses in rural areas. Is that push paying off? Is it working?
Absolutely. And I would also just compliment what Debbie said in terms of the screenings. We have a large number of dental screenings and referrals.
Yeah, that surprised me. I didn't know y'all did the dental part.
Yes.
Yeah.
And but from the Medical College of Georgia, in terms of getting more physicians in rural and underserved parts of the state, we're absolutely looking at that. And it is across the country that we're going to have healthcare provider shortages in all of the areas. But for the Medical College of Georgia in 2021, we partnered with Centene. We partnered with the state of Georgia and the Medical College of Georgia Foundation to develop a scholarship program. It's really an opportunity for us to find students who commit to practicing and serving in rural parts of the state, that they actually have their tuition paid for. And so we're recruiting students from rural and underserved areas as best we can. We've got pathway programs in the high schools at the junior and senior level. But the idea is that they arrive at the Medical College of Georgia on this, we call it MCG 3+. It's a three-year curriculum. And then they serve each year of their tuition through rural and underserved parts of the state. That's where they'll do their residencies as we formulate this program out. But it's a program, we've raised about $50 million for it. We had our largest cohort this year with 12 students, but our first cohort, they're actually in their residency right now. And so when they complete that, they'll be serving in rural and underserved parts of the state. But we want to continue to find ways to do that. And a lot of it is the recruitment, it's the pathway programs in the high schools and the middle schools and beyond to get them connected to a medical education.
Debbie, can non-farm workers come here to get checked out, or do we want to just keep our focus on those workers for the Costa Lehman Health Fair?
This event is only focused on the Costa Lehman workers, but we are looking to partner up with another large employer in Edgefield County and replicate this same set of services for them as well. So we're trying to expand.
Okay, that's good. And I know that
exciting.
you'll see success. Let me just ask you this, and we'll wrap it up with you, Debbie. And we are going to have Dr. Keene on for our next segment to talk about all things Augusta University. So you'll want to stick around for that. But just on a personal note, have you ever had a moment where you see somebody and you say to yourself, thank goodness Barry and I started this back in the day, because look at the difference it's made. Look at the light in that person's eyes that maybe wasn't there a few minutes ago.
Absolutely. Absolutely. When I look at the workers and I know what they shared with me years ago, voluntarily, of course, about their health issues. And when they come back and tell you year over year, my blood pressure's under control, my glucose is under control, I got glasses, I got hearing aids, whatever it is, but to know that this event propelled them to taking better care of themselves, yes, it's wonderful. And I'm very grateful that Augusta University has been such an amazing supporter for 20 years to continue this program, and looking forward to the next 20 years.
Me too. Me too. Congratulations on 20 years. And yeah, here's to many more. Dr. Keene, Debbie Lehman, thanks for what you do for Augusta University and for our community. We appreciate you.
Thank you.
Thank you very much.
Absolutely. When we come back, Dr. Keene sticks around and talks to us about, I don't know, there's like 50 things here that are going on at AU, and we'll try to cover as many as we can. Exciting times for sure. On the Means Report.